Cancer treatment has become both more sophisticated and more expensive, and with newer therapies often costing patients tens of hundreds of thousands of dollars, that is, annually. But what if some of the medications that could help are already on pharmacy shelves? Generic, off-patent, well understood from decades of safe human use.
A team of physicians from the Wellness Company has just completed a first-of-its-kind human observational report on the off-label use of two such medications, ivermectin and mebendazole, in cancer patients. The manuscript is currently under peer review.
So here to walk us through the findings is Chief Scientific Officer at the Wellness Company, Dr. Peter McCullough. Doctor, thank you so much for coming on. We appreciate that. Let's talk about this. So your team looked at ivermectin as well as mebendazole. I'm probably butchering the name. I was so close. I was practicing it. But what did you find?
You know, we looked at the elective use. Patients were choosing to use this in addition to their cancer treatment programs, two anti-infectives, ivermectin and mebendazole, for their off-target anti-cancer properties. And you know, after 6 months of use, we asked them questions, and we were so delighted to learn that nearly 1 in 2, the cancer was either in remission or had improved.
Wow. I mean, it's striking data and very encouraging. What should not just cancer patients, but also their physicians take away from your findings? Well,
it'll be in the peer-reviewed literature shortly, and I think it's going to be a big push now in the scientific community to examine use of these off-label drugs. Now, this is not a controlled clinical trial, and so we do need the large prospective double-blind randomized placebo-controlled trials to be done in order to ascertain, does it really have the effects we see in our first report?
You've also made that point that the repurposed medications, they don't get the research investment that they probably deserve.
Well, that's the role of the National Cancer Institute. There's no doubt about it that our government cancer agency has an obligation to explore any and all options to treat cancer. In other fields of medicine, for instance, cardiology, 90% of the drugs used are generic. There's no reason why that shouldn't happen in cancer.
Incredible. What does the research community need to do with these findings, and also how can people learn more? Because I think, when you hear this, it's exciting and you want to understand it and hopefully get connected to it.
In cancer, there are cooperative clinical trials. Cancer centers actually are incented to do that. These drugs should be added to these clinical trials programs. There needs to be dose ranging, so to figure out the optimum dose. Patients chose their own dose in this case, but there should be a protocol-driven dose escalation as well as dose duration, and tested across a variety of different cancers. Remember, not all treatments apply to all cancers.
And that's a good point, because there are various cancers out there, obviously some more severe than others. But how do you anticipate that this will now become more mainstream? Is that something that, you'd want to have the right dose and you'd want the right drug for what you're taking, but obviously, how do you get that more mainstream?
A lot of times, in this case, patients will decide. So this is called joint decision-making, where the patient, along with their doctors, will say, listen, I'm looking at this. This looks favorable. I want to give it a try. Now, ideally, it would be in a clinical protocol where we can track outcomes and specifically randomize between placebo and the combination of ivermectin and mebendazole.
And Dr. McCullough, again, these are, I think, names of drugs that people have heard before. But again, I want to point out that, again, these are things that are already on the shelf. So there's already safety understandings. We also know how this has already worked for people under other umbrellas. So I know you said that this hasn't been clinically tested yet, but that's for this usage.
Correct. So safety is paramount. Remember, we always discuss safety before efficacy. In our observations, there was about a 25% rate of having some side effects, which is expected, but 94% of those patients with side effects were able to continue. So I have to tell you, for a cancer treatment, I can tell you as a doctor, this is very well tolerated, the combination of ivermectin and mebendazole.
How much research has been done on this, going back? Clearly it's been out, these drugs are out there, but how much research has been done?
Well, ivermectin and mebendazole have been used for decades as anti-infectives, but there also are at least a decade or more of preclinical data showing anti-cancer effects. These drugs both work to reduce the proliferation of cancer cells, drop the blood supply to cancer cells, and actually help the body sweep them away in a process called apoptosis. So, there's been sufficient work done on these for us to understand that, yeah, they do have anti-cancer properties.
Wow. Well, really exciting, groundbreaking movement towards a cure, which of course is what everybody wants. Dr. McCullough, thank you so much for walking us through it so carefully. That's important. Also, great information out there. And if you want to learn more and you want to read about the study itself or even learn more about ivermectin and mebendazole, compounded medications that we talked about, you can visit twc.health/cancer and just use the code NEWS. We appreciate it.
Doctors say having a medical emergency kit is like having an urgent care and pharmacy at home. Let me bring in Dr. McCullough to explain more.
Most people know when they're getting sick, but waiting to see a doctor is often too late.
So the key is having medicines before you need them.
Yes, and it includes doctor-prescribed medicines to treat common and serious issues like generic Z-Pak, amoxicillin, antibiotics, antivirals for flu, pneumonia, strep, ear and sinus infections, UTIs, and more.
So it is like having an urgent care at home.
Exactly. No waiting, no pharmacy, no copays. You feel better faster and avoid serious complications and hospitalizations.
How do you know what to take?
Just match your symptoms to the doctor-written guide or schedule a quick telehealth call.
Great advice. I understand ordering is fast online, and we've put the website and $45 off code on the screen. Thank you, doctor.
Visit urgentcarekit.com/news, promo code NEWS.